I'm Dr. Adelaide A, sharing with you some highlights of my discussion at the Winter Clinical Meeting in Hawaii. I want to talk to you today about one of my favorite topics in clinical conditions, which is hyperhidrosis. I've been long interested in this particular constellation of challenges posed by patients who have hyperhidrosis. I do serve as one of the board members of the International Hyperhidrosis Society, and if you haven't checked out the website, please do so. You can also go to sweathelp.org. That's one of our web pages, and it will give you all kinds of information. We also want to talk today about one of the FDA-approved products, which is botulinum toxin. This particular agent is approved for injection in those patients 18 years and older. The current company that owns this particular product has a website that talks about a botulinum savings program for patients who suffer with hyperhidrosis. Why do patients actually have hyperhidrosis? The truth is we really have not figured this out yet, but some scientists have actually recognized that there is a higher expression of acetylcholine and alpha-7 neuronal nicotinic subunits on the sympathetic ganglion. Whether or not this is the actual cause of hyperhidrosis in the patients we see, can't answer that question today, but I hope we all stay tuned as we learn more. For the patients that I see with hyperhidrosis, I check them for hyperflexibility of their joints, and I ask them if they have any history of cardiac disease or fainting. If I get any yes answers or findings on the physical exam that suggest joint hypermobility, I consider working these patients up for dysautonomia or send them to one of the dysautonomia centers of excellence across the United States. These patients can benefit from the cardiac and neurologic evaluations they get, and they often can be treated very successfully with medications used in those domains as opposed to some of the medications we use in dermatology, although these can be great adjunctive therapies for patients who suffer with dysautonomia.